Greetings, bloggers, vloggers, followers, and potters. Dustin here from Dustin's Dynasty, ready to start with you on another about some self-care too and what to do. Um, they're good for your mental and physical health, and they can help you take charge of your life, take care of your body for your mind, and connect with others to benefit from your mental health. So basically, taking care of your body, being mindful of your physical health. Be sure to get some sleep. I know, you know, even after a long day, I need to get some sleep because it's hard. It's hard. Be sure to go to bed and get up at the same times each day. Stick close to your typical sleep-wake schedule, even if you're staying at home. Uh, Participate in regular physical activity. Now, I know the weather has not been conducive totally for that, but it's important to have regular physical activity, and exercise can help reduce anxiety and improve mood. Find an activity that includes movement, such as dance or exercise apps. Get outside, such as a nature trail or even your own backyard. Sometimes it's just taking a walk around the block that is very helpful for me. The next one is to eat healthy. Choose a well-balanced diet. Avoid loading up on junk food and refined sugar. Limit caffeine as it aggravates stress, anxiety, and sleep problems. Avoid alcohol, tobacco, and drugs. If you smoke tobacco or you vape, you are already at high risk of lung disease because COVID-19 affects the lungs. Your risk increases even more. Using alcohol to try to cope can make matters worse and reduce your coping stress skills. Avoid taking drugs to cope with unless your doctor prescribes medications for you. Limit your screen time. Turn off electronic devices at least sometime each day, including 60 minutes before bedtime. Make a conscious effort to spend less time in front of a screen, and this includes television, tablet, computer, and phone. Relax and recharge. Set aside time for yourself. Even a few minutes of quiet time can be refreshing and help settle your mind and reduce anxiety. Many people benefit from practice such as deep breathing, Tai Chi, yoga, mindfulness, and meditation. Soak in a bubble bath. Listen to music and read or listen to a book. Whatever makes you helps you relax. Select a technique that works for you and practice it regularly. Also, please know that it's okay for men to ask for, time to have alone, to take care of their mental health. Sometimes men struggle with asking for help for their mental health, and it's noted as a shame or it's a stigma for men. And there's no shame or stigma in men taking time for themselves to take care of themselves. Just we know that. Many times men are made as the alpha male uh, head honcho sort of thing, and that everything that you man up and everything's going to be okay. When the truth is that your feelings are just the same as somebody else of a different gender. So please do, men, take care of yourself too. Take care of your mind. So you need to reduce stress triggers by keeping a regular routine. You need to retain a regular daily schedule as much as you can. The regular bedtime routine. Stick consistent times to meals, bathing, and getting dressed. Work or study schedules and exercise. Also set time for activities that you enjoy. This predictably can make you feel like you're more in control, and that is so true. You need to feel, as autistics, we thrive off of routines, and diverting from the routine doesn't make it any different of how we want to live our lives as much as we can given the predicament. So, and the next one is limit exposure to news media. Constant news about COVID-19 from all types of media can heighten fears about the disease. Limit social media that may expose you to rumors and false information. Also, limit hearing or watching other news, but keep to date the national and local recommendations. Look for reliable sources such as the CDC and WHO. It's very important to limit. I've heard from 15 to 20 minutes a day. It's very important to limit that and not, overload in that information. So, I personally try to limit to 15 to 20 minutes a day, and not even just of COVID-19, but all news. I try to watch the news from the beginning to the weather forecast, and that's about 22 minutes tops. Stay busy. Healthy distractions can help you To get away from the negative thoughts and feed anxiety and depression. Enjoy hobbies you can do at home, and I've been doing that. That's why I write this blog. I do the vlogs, and it's very my blog is a very robust blog because I do things. You can read a book, write in a journal, make a craft, play games, cook a new meal, or identify a new project like a cleaning out a closet that you promised to get to. Doing something positive can manage anxiety is a healthy coping strategy. Also, what I found out is making sure that your laundry is kept up because that's a necessary evil if you have access to laundry within your home. It's very important to do that, and it makes you feel good. Also, cleaning up around your house is another mindful activity that I find is very clean, very good. Always focus on the positive. Choose to focus on positive things in your life instead of dwelling how bad you make you feel. Considering each day starting with a list of things you are thankful for. Maintain a sense of hope. Work to accept changes as they occur and keep problems in perspective. Use a moral compass for spiritual life or support. If you draw from a belief system, it can bring you comfort during uncertain and difficult times. Set priorities. Don't become overwhelmed with creating a life-changing list of things you want to achieve when you're home. Set reasonable goals each day and outline steps you can take to reach those goals. Give yourself credit for every step in the right direction, no matter how small, and recognize that some days will be better than others. Connect with others. Make connections, build support, and strengthen relationships. If you work remotely or from home, or you need to isolate yourself for a period of time due to COVID-19 and social isolation, find time each day to make virtual connections by email, text, phone, or video chat. If you're working remotely from home, ask your coworkers how they're doing and share coping tips. Enjoy virtual socializing and talking to those from your home. If you're not fully vaccinated, be creative and safe when connecting with others in person, such as going for walks, chatting in the driveway, or other activities, or wearing a mask for indoor activities. If you are fully vaccinated, you can safely return to many indoor and outdoor activities you have not been able to do because of the pandemic, such as gathering friends and family. However, if you are in a high area with high number of new COVID-19 cases in the last week. CDC recommends wearing a mask indoors or outdoors for crowded areas and close contact for unvaccinated people. For unvaccinated people, outdoor activities allow free space between you and others pose less of a significant risk for COVID-19 than others do. Do something for others. Find purpose in helping people around you. Helping people is an excellent way to help yourself. For example, text or call to check on your friends, family members, or neighbors, especially those who are older. If you know someone can't get out, ask if there's something they can get, such as groceries, a prescription pickup. Support a family member or friend. If your family member or friend needs to be quarantined at home or in the hospital due to COVID-19, come up with ways to stay in contact. This can be through electronic devices or the telephone, sending a note to brighten the day, for example. Avoid stigma and discrimination. Stigma can make people feel isolated or even abandoned. They may feel depressed, hurt, angry, or when friends and others in the community to avoid COVID-19. Stigma harms people's health and well-being in many ways. Stigmatized groups can feel often deprived of the resources they need to care for themselves and their family during a pandemic, and people who are worried about being stigmatized are less likely to get medical care. People who have experienced stigma related to COVID-19 include people of Asian descent, healthcare workers, people with COVID-19, and those released from quarantine. People who are stigmatized may be excluded or shunned, treated differently, denied job and educational opportunities, and be targets of verbal, emotional, and physical abuse. You can reduce stigma by getting the facts about COVID-19 from reputable sources such as the CDC and WHO, speaking out if you see inaccurate statements about COVID-19 in certain people and groups, reaching out to those who have been stigmatized, and showing support for healthcare workers. Recognize what's typical and what's not. Stress is a normal physical and neurological and physical and psychological reaction to the demands of life. Everybody reacts differently to different situations, and it's normal to feel stress during a crisis, but multiple challenges, such as the COVID-19 pandemic, can push you beyond your ability to cope. Many people have mental health concerns, such as symptoms of anxiety and depression during this time, and their feelings may change over time. Despite your best efforts, you might find yourself feeling helpless, sad, angry, irritable, hopeless, anxious, or afraid. You may have trouble concentrating on typical tasks, change in appetite, body aches or pains, or difficulty sleeping, and you may struggle with routine chores. With these signs it lasts for several days in a row, it may make you miserable and cause problems in your daily life that make it hard to carry out normal responsibilities. It's time to ask for help. So hoping mental health problems such as anxiety and depression will go away can lead or on their own can lead to worsening symptoms. If you have concerns or if you experiencing worsening or mental health symptoms, ask for help when you need it. Be upfront about what you are doing. To get help, you may want to call or use social media to get a hold of a close friend or a loved one. And it may be even though it may be hard to talk about your feelings, contact a minister, spiritual leader, or someone in your faith community. Contact your employee assistance program if your employer has one, and ask for counseling and for a referral to a mental health professional. Call your primary care or mental health professional. Ask about appointment options to talk about your anxiety or depression. Get advice and guidance. Some may provide the option of phone, video, or online appointments if your insurance covers that services. Reach out to your local NAMI or National Alliance on Mental Illness, the Substance Abuse and Mental Health Services Administration, and the Anxiety Depression Association of America to help get guidance on information and treatment options. If you are feeling suicidal, thinking of hurting yourself, seek help. Contact your primary care provider or your mental health provider, or call a suicide prevention hotline. Call which is 1-800-273-TALK. Again, that's 1-800-273-TALK. Or in the United States, you can text home to 741-741. Again, text home to 741-741. Or you can even go online at suicidepreventionlifeline.org/chat. Continue your self-care strategies. Even though your feelings can be strong feelings to fade when the pandemic is over, but stress won't disappear from your life when the health crisis of COVID-19 ends. Continue these self-care practices to take care of your mental health and increase your ability to cope with life's ongoing challenges. I want to thank you for listening. As always, be sure to give a like or a dislike on the video. Be sure to tap a notification bell if you want to hear more notifications. Subscribe to my channel. Be sure to like and follow me on Facebook, Instagram, and Twitter at Dustin's Dynasty. Visit me on the web at DustinsDynastyUSA.com. Follow me on Pinterest and TikTok at Dustin's Dynasty ASD. And follow me on this podcast will be transposed into this vlog will be transposed into a broadcast available at on Spotify and many other platforms at Dustin's Dynasty. I want to thank you for listening and have a good day.